Are air bubbles in my injection pen dangerous when injecting medication? If you've noticed air bubbles in your GLP-1 injection pen, you're not alone. It's one of the most common concerns patients have, and it's completely understandable to worry about it. Before we go any further, a quick note. This video provides general information only and is not a substitute for advice from your GP, pharmacist, or diabetes team. Always follow the patient information leaflet and the instructions for use for your specific pen. Here's the reassuring news. Small air bubbles in subcutaneous injections are not dangerous. GLP-1 medications like semaglutide, dulaglutide, and liraglutide are designed to be injected subcutaneously. That means into the fatty tissue just beneath your skin, never into a vein. Any small air bubbles that enter this fatty tissue are simply absorbed harmlessly by your body. They cannot cause an air embolism or any serious complications. So where do these bubbles come from? They can appear during the manufacturing process when the pens are being filled. Temperature changes during storage or transport can also cause air to separate from the solution. Sometimes just attaching a new needle or handling the pen reveals air pockets that were already there. Small bubbles are actually quite common in multi-dose injection pens and don't mean your medication has gone off. Now, while small bubbles aren't harmful, larger air bubbles can affect how much medication you're actually receiving. If a significant amount of air takes up space in the dose chamber, you might not get your full prescribed dose. That's why it's worth removing larger bubbles before you inject, but only if your device instructions tell you to do so. This is really important. Different pens have different procedures. Some single-use auto-injectors don't require any priming or bubble removal at all. Multi-dose pens typically do. Always follow the specific instructions for use that came with your device. Don't improvise or try techniques you've seen elsewhere if they're not in your device instructions. If your device instructions do recommend removing air bubbles, they'll guide you through the process. This usually involves holding the pen with the needle pointing upwards, gently tapping to encourage bubbles to rise, and performing a flow check as described in your instructions. This confirms your pen is working properly and pushes out any air. But again, only do this if your specific device instructions tell you to. Before each injection, take a moment to inspect your medication. The solution should be clear and colourless or nearly colourless. If it looks cloudy, discoloured, or has visible particles floating in it, don't use it. Contact your GP or pharmacist for a replacement. When you're ready to inject, proper technique matters, and your device instructions for use will guide you through this. Follow them exactly. Your healthcare professional can also demonstrate the correct technique for your specific pen if you're unsure. Remember to rotate your injection sites with each dose to avoid irritation or changes to the fatty tissue. One crucial safety point. If you think you didn't receive your full dose because of air bubbles or any other reason, don't take an extra dose to make up for it. Follow the missed dose advice in your patient information leaflet or speak to your healthcare professional. After injecting, dispose of your needle immediately in a sharps bin. You can get one from your GP surgery or pharmacy. Never reuse needles or share pens with anyone else, as this increases infection risk and can affect dose accuracy. If you're consistently seeing large bubbles that won't clear, or if your medication looks cloudy or unusual, contact your GP or pharmacist. They can check whether there's an issue with your pen or provide a replacement. You should also seek medical advice if you experience severe or persistent abdominal pain, which may indicate pancreatitis, or symptoms of an allergic reaction such as difficulty breathing, severe rash or swelling of the face or throat. These are rare but require urgent attention. Call NHS 111 for advice or 999 in an emergency. If you think you've experienced a side effect from your GLP-1 medication, you can report it through the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. This helps monitor the safety of medicines used in the UK. So to recap, small air bubbles in your GLP-1 pen are normal and not dangerous when injected under the skin. Remove larger bubbles only if your device instructions tell you to, and always follow the specific procedures for your particular pen. Different devices have different requirements, so never assume one technique fits all. Remember, if you're ever unsure about your injection technique or have concerns about your medication, speak to your healthcare professional. They're there to support you. Have you had concerns about air bubbles in your injection pen? Let us know in the comments. And if you found this helpful, give us a like and subscribe for more practical health guidance from Bolt Pharmacy.